In this session, we demonstrate, how you can take a stuck burr out of coronary. So you can see here. So what you need for that is one cutter. So to do the disassembly of rotablation. So you have various techniques to do it. You can see here. This is like a stuck burr here. So what you can do is you can send a parallel wire. If you have a 7 French guide, you can send a wire parallel to the burr into the coronary, and then you can try pulling out burr. So, and sometimes you can take a second guide and send a wire parallel, that's and then take a balloon and dilate, and you can take burr out. So these are the techniques. So but most handy technique for me, which I prefer and more predictable technique with less complications, is disassembly. So in this, what we have to do is just so take a cutter, cut your rota wire shaft here as distal as possible, like this. So now it is cut. So now what you can do is you can take this sheath out, just hold the burr, yeah. So your burr is stuck, so you just take the sheath out, you can see the sheath is coming out. Now the sheath is out. So once the sheath is out, basically you created lumen inside the guide. So now you take a guide extension. This is a guide extension. See, for this you need best is 7 French system. So if you have even 6 French also, you can do it with 6 French guide extension. So this is a guide extension. You just send the guide extension over it. So its guide extension is sent. So now you can see here, so your guide extension is at the burr. So now what we have to do is, so you pull the burr, so by pulling this shaft, pull the burr and push your guide extension. So what essentially we are doing is we are giving a counter traction to the traction on the burr, so that the vessel won't get perforated. So that's the main thing which we have to do. So push guide extension and pull the burr. So that's how you can slowly pull the burr out. Done.